Now in our NSAID group, second last drug is paracetamol. Extremely important drug. You must know about paracetamol in much detail. So paracetamol is also called as acetaminophen. Acetaminophen, mostly used in different countries. In India, it is commonly called as paracetamol. For paracetamol, different dose tablets are available. You can find it in 325 milligram tablets. You can find it as 500 mg, 650 mg, and 1000 mg. Right now, this 325 milligram dosage is usually used to when we combine the paracetamol with some other drug, we use this dosage. Now, usually when we give paracetamol alone, okay, you can use these three combination. So it will range somewhere about like 500 to about 1000 milligrams, and you can give like every 4 to 6 hours. All right. So let's consider 4 hours. So 1000 milligrams every 4 hours will come to about 4000 mg per day, right? Which will turn somewhere about 4 grams per day. So if you go beyond 4 grams per day, right, it will cause troubles, right? And as the dose even increase more and more beyond 4 grams, 5 grams, 6 grams, let's say, it will cause more and more hepatotoxicity. So one of the key feature for paracetamol is that it may not cause this gastric bleeding, but it can cause hepatotoxicity, right? Now before moving on to paracetamol any further, let's see the table. Paracetamol, the number 12, is a very good analgesic. It is a very good antipyretic. However, it does not cover much for inflammation. It is only the mild form or none. Okay. Paracetamol only acts in two different ways, right? In the previous lecture, we have already discussed how the paracetamol and this combiflam thing works. So the paracetamol mainly, okay, it works mainly centrally, okay, and then slightly peripherally, but centrally it focus more on COX-3 enzyme inhibition, right? However, it does act peripherally also, but not that strongly. It does affect COX-1 and COX-2. It causes their inhibition, but not as much as this COX-3. So primary function of paracetamol is by acting centrally, right? And this decreases pain and fever. Right. So because this GI risk is almost like none, so let's write it over here. GI risk is none. Okay. Because why? Because COX-1 and COX-2 were major. They were taking major role in contributing to GI risk for bleeding, but because they're peripherally, it inhibits like the least COX and COX-2 inhibition, and because of this, there's nothing left to cause the GI bleed. So there is no GI bleed when we give somebody a paracetamol, right? Now, what are the mechanism? So, right, we've already discussed it inhibited the COX-3 primarily, but also peripherally COX-1, COX-2 very slightly. Onset of action is again very fast, 15 to 30 minutes. It peaks at around 1 to 2 hours, and total duration of action is 4 to 6 hours. Now, because the duration is somewhere about 4 to 6 hours, that's why we need to give another dose after 4 to 6 hours over here, right? But remember, don't increase the dose more than that. So max dose is 4 gram per day, not more than that. You can give 1000 milligram 4 tablets, okay, or 500 milligrams 8 tablet, right? So we have discussed about onset of action, peak, and duration. Now let's talk about indication of paracetamol. Now, paracetamol is used widely in a lot of conditions. Primarily, it is used for fever and pain. If a person has malaise, fever along with pain, give it. And it is also safe for the GI patient and the patient with some issues related to kidneys. So we were talking about the side effects. Paracetamol only causes hepatotoxicity, that too at high doses, somewhere at around 4 grams per day, that we've already discussed. Now let's say somehow we reached this high dose, 4 grams per day, and we somehow administered something wrongly goes on, and we reached a toxic range. Okay, so let's say we have accidentally, not of course, nobody gave it intentionally, accidentally we reached toxic level of paracetamol. Okay, let's say 6 gram per day. Okay, 6 gram, 8 gram, 10 grams, like that. At that time you can administer, if the patient has symptoms of paracetamol toxicity, at that time you can give patient NAC. This is the antidote of paracetamol. N-acetylcysteine, N-acetylcysteine, right? You must know this name because it is asked a lot of the times. Right, now because paracetamol is really very, very famous drug, right? And it is used so much widely, right? So let's consider how it is actually combined with other drugs. Combination. It is combined with a lot of drugs, all the drugs you can imagine. So in the previous lectures we have discussed, see over here the paracetamol was present, right? It was also present with celecoxib. It was also present with the aceclofenac, right? Even if you go above over here, see, for the diclofenac, even with the nimesulide, even with piroxicam, just name the drug, you will see a combination with paracetamol present. See, even with the propafenazone, paracetamol was present. Then with ketorolac, it was not needed. For mefenamic acid, again, mefenamic acid, meftal P was PCM, right? But depending upon the need, we can add 325 milligram or 250 milligram. It will depend upon this pharmaceutical company's choices, right? Now naproxen, we didn't consider the naproxen, the combination dose, because there were combination dose present with the ibuprofen. So ibuprofen has with paracetamol the Zerodol. See, combination with ibuprofen, PCM, paracetamol over here. Right. So we discovered that PCM, paracetamol, is abbreviated as PCM. Okay, PCM. Now let's talk about this PCM combination. So PCM was with ibuprofen. Okay, it was with diclofenac. It was with aceclofenac. It was with nimesulide. Okay. However, it is not recommended, but again, you can use paracetamol with caffeine. You can use with some other drugs also. You can use it now because the paracetamol does not have this anti-inflammatory. So you can add some other drugs, ceratopeptidase. Okay, you can also use dicyclomine. Along with it, you can also use some antihistamines, phenylephrine, and so on. So you can also use, for example, a patient has so much pain, so you can, in this condition, you can use PCM with tramadol. Right, so all this combination will work for the patient very, very well. Right, and also very, very safe drug actually. You cannot mess up with this drug in most of the conditions. However, only thing you must remember that when you give paracetamol beyond a limit, it can be hepatotoxic. This thing you must remember. That too when we give beyond 4 grams per day. Right, so this was all about paracetamol.